Yes, ma'am, we are live now.
Good evening, doctors. A warm welcome on behalf of Shield Healthcare. I'm Dr. Prachi. I welcome you all. And
Prachi, wait, program is not going live. Not going live yet. Because I will get a notification. Yeah, now it started. Yeah.
good evening, doctors. Thank you very much for joining today's program. And I'm Dr. Prachi from Shield Healthcare, and I welcome you all. Yet again, we are bringing a new episode, that is the Icons in Conversation with Dr. Ritu. I am privileged to introduce Dr. Ritu Santwani. Ma'am is IVF specialist and infertility specialist, founder and CEO of 360 Degrees Healthcare Studio, and also co-founder of Ma'am and board member of SWWC. We have another icon today, Dr. Vivek Taneja. Sir is MBBS MS ENT, certified practitioner in neuro-linguistic programming and also diploma in aesthetic medicine. So we are very happy to have you with us. Thank you very much for accepting the invitation, and it would be a wonderful conversation with you. So over to you, ma'am. Thank you very much.
Yeah. Thank you, Prachi, and thank you, Shield Pharma, for constantly providing the platform for this program from last 2 years. Thank you so much. So friends, as you all know, this program is very popular amongst not only in the India, but across the geography. So in this program, every week, I'm inviting one of the stalwart to discuss a particular subject. Now, from last few weeks, we are inviting the cross specialty. So today, a very dear friend of mine, Dr. Vivek Taneja, is with us. Dr. Vivek, we are really very, very thankful to you that you have accepted the invitation, that too also in a very short time duration. So friends, as Dr. Prachi has introduced Dr. Vivek, but I want to add some more things. I know Vivek from since long, a wonderful human being. And two things I especially want to mention, that he has got a lot of gold medals for the poster presentation and also for the paper presentation 3 times. So, and besides this, one additional, I think I want to highlight this quality, that is a certified practitioner in neuro-linguistic programming. That is really great, Vivek. So he's having a certificate in laser in ENT, certificate course in hair transplant, diploma in aesthetic medicine. So a lot of skills. So Dr. Vivek, from the ENT, you had got an interest towards the aesthetic medicine. That is also really, really a great. Yes, though me also being a gynecologist, my interest has gone towards the cosmetic gynecology and cosmetology also.
So ENT gives you a site, you can do a lot of cosmetic procedures, especially for the face and neck. So and people are also looking for it. So I have added it and I'm working on it.
Yeah. Great. So today's topic, what Dr. Vivek is going to discuss with us is very important, is the thread facelift. I know in this scenario, everyone wants to look forever young, or I can say the aging gracefully. Forever young, looking forever young is a dream of everyone. So without wasting time, I'm handing over the dais to Dr. Vivek. First, we will listen to Dr. Vivek, then later on we can ask the questions. Meanwhile, I want to welcome some of the friends who have joined across the geography. Dr. Sheikh has joined from the Bangladesh. He has already dropped me the message. Dr. Musraf has also joined from the Bangladesh. And Dr. Mona and Dr. Amila has joined from Kerio, and one more doctor has joined me the message, dropped my message. Yeah. Dr. Sharifa has joined from Kuwait. And I am able to see here Dr. Amal, Dr. Shalini. Yeah. A warm welcome to all of you. Yeah. Over to you, Dr. Vivek.
Thank you for an elaborate description. I will not take much time. I will start my slide and you let me know if it is properly visible so that we can further proceed.
Yeah, sure.
Yeah, is it visible properly?
Yeah. Perfect. Loud and clear. Perfect.
Okay, thank you. I'll just start it.
Yeah.
So, thread facelift are also known as an instant facelift. What is exactly a thread lift? A thread lift is a procedure that uses dissolvable sutures to tighten and lift the skin. It is a minimally invasive procedure and we complete it in a duration of 45 to 60 minutes. That too without the need of undergoing a scalpel. Threads. The most commonly used thread is a PDO. Polydiaphragm threads are most commonly used. PDO threads are biodegradable polyester sutures. They have been used in surgeries since 1980, and now they've been implied in a package which we can use it for lifting the face. They are made up of a colorless polyester that break down in the body minimally after 6 months. Not like the other threads which we immediately dissolve within a month's time. Now there are different type of PDOs. One is a mono thread, the one is the cork thread, and another is a screw thread. Let's look at details. Now with this image, you can see the difference between the type of threads. One, the mono thread is the first thread. Now the mono threads are more commonly used for tightening and loss of wrinkle lines. Next is the screw threads. Screw threads are in a form of a screw, so they help in volumization of the sunken areas of the skin. The third one are the cork threads. They are like a barbed wire. They have barbs. From which this is a typical thread which is ideally meant to use to lift these areas like your cheeks, your jaw areas which require lifting. Now we can have a detailed look at the mono threads. The mono threads, these are smooth sutures that help in rejuvenating the skin by stimulating collagen production. As we start aging, collagen is the part which we start losing. And that is what gives to sagging of our skin as well as the wrinkles and everything. So when we put these threads, over the period of time, they stimulate collagen production. They are placed in a mesh-like pattern to ensure the best tightening effects. They do not lift the skin at all. So now in this first image, we can see how they are ideally placed. They are placed in a mesh-like pattern so that the tightening of the area happens by collagen production. At the same time, where we have other loosening areas, like under the chin or the neck, this is the pattern which is ideally desirable. So a number of mono threads are put all over. Now next, coming over to the cork threads. These are thicker lengths of PDO that are loaded onto a cannula which is inserted into the skin. These threads have a little corks on them that engage the skin and can lift up the sagging skin of the cheek, jowl, or brow when the thread is engaged and pulled upwards. Now, ideally, these are the areas which we use the cork threads for the nasolabial lines, for malleolate lines, for the jaw area, the cheek area. This is a linear thread which can be inserted and then we can tuck it and pull upwards. The third one are the screw threads. These threads are made up of one or more intertwined threads, and these are used mainly to restore the volume of the sunken areas of the skin. Now, other type of threads that we get are PLA threads and the PCA threads. The advantages of these threads is a longer life, but most commonly used are the PDO threads. Now, the PDO thread lift, the areas that we can focus and the effects that we can get. We can use it on the eyebrow and forehead areas, crowfeet, under eyes, cheeks, nasolabial lines, upper lips, lower face, jawline, double chin, and the neck. Now, if we look at the eyebrow and the forehead areas, we can use this thread to lift and smoothen it. That will be using mainly the mono threads as well as the screw threads. For the crowfeet, it's tightening and smoothing, again the same thing. For under eyes and cheeks, there are threads which are put in longer from an angle point, entry point to the cheeks, nasolabials. Now these are the mainly cork threads that will be introducing from one entry point all over the cheek. as well as nasolabials, marionate lines to the jaw, and gradually pull it up to the desired effects. Next, we can look at the procedure. See, it is a short procedure and can even be done in a coffee break style. The surgeon sits you on a reclined seat and the face is cleaned with alcohol swabs. An entry hole is made using a whiteboard needle. So like these, in this image, you can see we have various entry holes where can be, and through the same entry hole, multiple cork threads can be introduced of this different lengths and different thicknesses. Then the threads come into a cannula already loaded. So as you made a desired pattern of how many threads you would be using or how much area you require to work in. So from one entry hole, you can introduce, as you can see, in up to 5 threads, we can introduce one by one after the other. And after the thread has been introduced to the entire length, what we need to do is the thread is anchored at the end and the cannula is taken out. After that, the thread is pulled up to tighten as well as pull up the skin. And finally, the extra thread that is remaining can be cut off and secured at the end, giving you a good instant lift. So now, the post-operative care for these procedures isn't much. The advice is to avoid excessive speaking for a couple of hours, avoid rubbing of the face, avoid smoking or drinking through a straw for a week, sleeping over one side, visiting saunas, and getting a face massage. Because initially, within the first 1 to 2 weeks, the threads are fresh, and then you can disturb them and they can get dislodged. The complications are minimum. Minor complications occur, that too in 10 to 15% patients, and which can be easily corrected. Pain is there, inflammation up, blood clots happen at times. Sometimes, if you visit someone who is not frequently doing it, you can have a visible thread left. As well as if improper introduction of threads are done, a dimpling can be seen. And there is another risk, sometimes as you're introducing those long cannulas and you are not sure of the anatomy, then there could be a little injury to your salivary glands. The results are instantly visible. They gradually improve over the coming weeks. Because as you introduce the threads and you will be adjusting them, so the results are like, for example, if I introduce the threads and I'll be pulling, so you will see an instant pull. So some of the results is instantly visible, and then gradually over the weeks, as the threads take up the space, as well as further collagen production is initiated, more better results start coming up, which are more identifiable up to a month's time. The results can last over 1 to 2 years, depending upon the age group of a patient. In younger age group patients, the results last for a longer time. Metabolism rate. If a patient has a higher metabolism rate, then the threads get resolved earlier. Excessive exercises, again, is not a good friend for the threads. A lot of exercise will enhance your metabolism rate and other enzymes, so which the results will not last for a longer time. Smoking and drinking habits, again, the results go down. Now I'll show you some before and after images of threads put in patients. Now in this image, this is you can see the before and after changes of the threads. This was immediately before, and the other picture that is taken is weeks after. The swelling and all the entry marks have gone away. So this is the difference that you can see immediately in the patient with threads. And there's one more image you can see. There are marked differences on her nasolabial lines, her marionate lines. Then see third image, in this image, you can see her jowl area. There is a marked difference in her jowl area, her nasolabials, as well as the marionette lines. Advantages over the traditional surgical facelift. Instant results, minimal swelling, non-surgical office procedure, no scarring, minimal risks, slight swelling and bruising that can happen. 28 to 48 hours is the recovery time. As compared to the surgical facelift, where you need a hospital admission, anesthesia is required. Apart from that, there is a 1 week to 1 month's recovery time. The patient can immediately continue working. These are the advantages of it. Thank you.
Fantastic presentation, Dr. Vivek. A very crisp and very fantastic presentation. Dr. Vivek, I am having 2-3 queries.
Yeah, go ahead.
Yeah, as you told about this, so you told the patient can continue the activities.
Right.
So what about the swimming? Because these days, a lot of patients are coming, and this is the first query by them, that after the doing this thread lift, from when they can go for this swimming and other aerobic activities. Yeah.
See, for vigorous exercises, I would recommend that you take a 1 week to 10 days break.
Okay.
Firstly.
Okay.
And see, now when it is swimming exerts a lot, as well as regular swimmers have a higher metabolic rate.
Yeah.
So as compared to a patient who is not into exercise at all, the results would be lasting for a lesser duration.
Okay. Okay.
See, on an average, what happens, these threads, the simple PDO threads, after 6 months onwards, they start dissolving. So generally what is expected is on the average 1 to 2 years results. Okay. Now, if somebody is on a vigorous exercise schedule or has a higher metabolism schedule, so the threads would dissolve earlier.
Okay.
So then the span of the results would vary.
Okay. And other query, that post this thread lift, if patient wants to use this moisturizer, sunscreen, can she use on the very next day, or she has to wait for 5 days?
First 2-3 days, we just give them an ointment to apply, so that there is no infection, no swelling, as well as a little bit antibiotic and painkillers. A combination of medicine is given to take down the swelling and everything. As well as sunscreen is advised, but with very light hands, so that there is no rubbing. For initial first week, they should not be, severe rubbing of the face, like severe rubbing, excessive talking for first 2 days, because then there are chances of dislodging the thread or the thread to move. So then that can give you complications.
Yeah, great. Thank you so much. Other query, you think this thread lift is superior compared to the Botox injections?
No, ideally, this is one of the options, right?
Yeah.
And threads are more commonly used for the lower face.
Yeah.
So for the middle and lower face.
Yeah.
So if you want a complete look, so then it is a combination of treatments. Then you take a combination of Botox as well as fillers as well as threads. So let me give you an example. See, if you go back.
You please stop sharing the screen. Okay. If you want to show, you can show something.
Yeah, now see, if you see this patient.
Yeah.
In this patient, she had a very good effect for her jaw area.
Yeah.
Now, if we come back, she still has some nasolabial lines left.
Yeah.
Right. Nasolabial lines are left, but her marionettes have gone.
Yeah.
So now, if we look at this patient, we would even get a more better result that if we incorporate threads along with fillers for the nasolabial areas.
Okay.
And if we add a little bit of Botox, so then we'll also have a little elevation of our eyebrows.
Yeah. Correct.
So now that depends on the patient's choice. They want to go for all three together. But otherwise, threads out of all the 3 treatments out of the Botox, fillers, and threads are the new ones, and they give alone threads give a decent amount of results itself.
Great, great. So can we use this combination therapy in the one sitting, or there should be a break of some days? Means can the filler and thread lift we can do in the same sitting?
See, all three can be done in the same sitting.
Okay.
See, now as we generally go for Botox and fillers.
Yeah.
So suppose we're doing a client's Botox fillers today.
Yeah.
We are calling them back after 3 days to 1 week, because if you're sensibly doing it, then you would be doing a little touch up 3 days or 7 days later.
Great.
So by that time, once you've done it. So now, for example, if you see this effect is in front of you. Now rest of the effect will come up in a week's time. So you can even make up your mind that if you would like to add one more thread or something. But see, ideally all three of them are taken together to give you the best results. But the threads, if you see, then threads are done after the 2 treatments.
Okay.
So that if you're doing threads, you do not disrupt the thread by accidentally putting your needle at the same spot.
Okay. Great. Very good practical point you have shared. Other thing, what's your experience in the cases where in some cases you have used the thread lift along with the PRP, or you are using the hyaluronic acid fillers? Means what your experience, I want to know.
I would say firstly it depends on person to person as well as the area of requirement.
Yeah.
See, fillers are more good for filling gaps, like where you under eye sunken eyes you have.
Yeah.
Then like now when you have these marionette lines as well as your visual lines and marionette lines, this justifies. As well as fillers can help you, little bit shaping the face. Like for in cases of females, like if we take this patient itself, if we add a little chin filler and give her a little more V-shaped look, so then she has a very feminine face, but then her femininity would further increase. So that depends on patient to patient what they choose. But the best results are a combination therapy.
Okay, great. So post this, because everyone is having a lot of queries. I am also having a lot of queries.
Yes, go ahead. We clear them.
Post this thread lift or post this botulinum, still you advise to go for the application for the different face serums as same as they are using earlier?
No, see, exactly. Initially, after threads, first thing is to refrain yourself from touching your face.
Okay.
Now, Botox and fillers are a different, so there is a different regime for them. But still, one thing is advised to all the clients to use a high-grade sunscreen, that is SPF 50 and above.
Okay, great. Okay. Is it like that the effect of this thread lift is little less in the smokers?
See, when you're smoking, or you're drinking from your straw, you're pouting your lips. So when you're moving it a lot.
Yeah.
Initially 2-3 days to 1 week, you have to give it time to heal.
Yeah.
You have put a foreign element in the skin. Okay, surgical part is done, you put it there, it is there. But see, once you put something new, so the surrounding area, even though microscopically, there would be inflammation, there would be pain and everything, as well as there will be swelling and everything. So you have to give it time to settle. Yeah. And smoking again, there will be one more point, the results will last for a lesser time.
Correct. So thank you so much. We are getting a lot of appreciation. Our dear friend Shivani has also joined. Shivani is also writing many congratulations for the wonderful presentation. So I think there are no more questions, only a lot of appreciations I am getting.
So thank you everyone.
Yeah. So thank you, Dr. Vivek, for taking out your time. Hopefully to have you in this program once again with some different topic.
Surely, Dr. Ritu, thank you for giving me the chance.
Thank you. Thank you. Thank you so much. Thank you, Shil Pharma. Thank you, Prachi. And thank you, Sahiti, for providing the platform. So with this, we will wind up for today, friends. Bye-bye. Good night. Good night, everyone.
Okay.
Thank you, ma'am.